everyone. This is Michelle Grimolia. I am the president and CEO here at Woodland Pond at New Paltz, and today is actually Tuesday, January 4th, 2022. And this is going to be my weekly update for a Tuesday. So this will re-air at 4 p.m. and at 8 p.m. on our closed circuit television channel, WPTV, on channel 1340. And will be available on our YouTube channel for whenever you want it. So for those that are not quite familiar with our YouTube channel, I've had a number of questions about that recently. So if you were to go to YouTube on the web, and there's a search bar there, you can look for a little magnifying glass. It's usually in the top right corner. You can search up Woodland Pond at New Paltz. And when you do that, our logo will pop up. You can click on that, and then you'll see across the screen a variety of different options. And what you look for is videos. So you can go to videos, and there on the videos tab, you can get all kinds of content. So there's tons of exercise classes, yoga, lots of performances, presentations, interviews, my updates. There's just a ton of things there. So if you're looking for Woodland Pond content, there is an enormous amount of Woodland Pond content on our YouTube channel. And if you hit subscribe, then whether you do that on your phone, on your tablet, on your iPad, on your computer, then you would get notifications if new Woodland Pond videos get added. So then that way, you would know, and you could click on the information. So that's a great way to always get access to information. Most of our content we do put there as well if it's videoed. So that's a great option for folks. So today I just wanted to go through a few things. So yesterday I issued an update memo that I actually did send out to the email listserv, and as well did put in the mailboxes, the mail cubbies here on campus. Because I revised the format of the COVID chart a little bit because there's a lot of moving parts right now. So the new format sort of tells you what's new today, what's still going on from yesterday or days prior, how many total cases might we have right now, or do we have right now, and then anything that's been cleared. And that's sort of broken down by categories of folks. So as you've seen, it's really, obviously unavoidable right now. There's a ton of COVID. The cases tend to be more mild. So we are seeing people that are sick, certainly, cough, congestion, headache, fever, those kinds of things. But we are not really seeing the same extreme level of respiratory distress and so forth that we had seen maybe a year ago in positive cases, particularly in those folks that are vaccinated and boosted. So although we have had a couple of residents that have been in the hospital, it's a little bit unclear as to whether or not COVID brought them to the hospital or if they tested positive in the hospital for other reasons. In some ways, it's a chicken and an egg kind of thing. There are lots of underlying conditions. So we are absolutely seeing the cases, keeping a very, very close eye on symptom development, whether that be in an employee or a resident, and really just, that's kind of the mindset right now. So if somebody is testing positive, obviously we want to keep them isolated. If they're a staff member, keep them off campus. But for folks, residents that live here, our number one goal right now is to make sure that we are aware of your symptoms. Because we don't want to just assume that they won't escalate. We want to make sure that they're not escalating. And then, of course, if hospital care is needed, then we would contact EMS to make a transport to the hospital. So where are we currently? We currently actually now have 6 cases. I'm sorry, I'm not reading this correctly. So in today's chart, you will see that we have 1 new positive today in a staff member. We will have 13 prior cases, so the 5 from yesterday, and then the existing others that are still active, for a total of 14. So that's up 1 from yesterday. Actually, that's not true. We actually have an independent living resident new today as well. I'm sorry. So we have a new independent living resident and we have a new staff member today. So our total count on campus will rise to 15. So I will send out a revised chart. Again, and I can't emphasize this enough. I've said this in my memos and in my emails and so forth. We're really seeing this kind of all over campus, just as it's sort of all over in the community. So we're not seeing it clustered. We're not seeing it concentrated, which in a way is troubling because we can't just isolate it to a specific area. But on the other hand, it tells me that the protective measures that we are doing and the careful steps that we're taking are keeping a spread from happening. So, we just have to kind of keep an eye on everybody at all times and make sure that we know exactly how everyone's feeling, monitoring folks, knowing who was exposed, and really just every day making sure that we know everyone's status. In yesterday's memo, I went on beyond the COVID numbers to really talk about how the numbers of positive staff are impacting our ability to staff, and also what isn't said in the memo because it's not explicitly included in the chart. But while we have X number of staff members at any given time that are obviously off the schedule because they're positive, we also have a variety of people that we're keeping off campus at any given time because they've either been exposed or they're symptomatic. So the CDC tells us if someone is vaccinated, exposed, and has symptoms, this is what you have to do. If you have somebody that's vaccinated, exposed, and has no symptoms, this is what you have to do instead. And then there are multiple scenarios like that. So I actually keep a chart, and the chart basically tells me, each different characteristic of the person and either their symptom profile, their exposure profile, and then the CDC guidance is right there to tell us, okay, this is how long this person needs to be out of work. This is what happens if it's a healthcare professional, meaning somebody that works at the bedside in the health center, versus a non-healthcare professional, which would be someone like me that primarily works in an office. There's a million different scenarios. So we really have to keep that straight and apply the logic strictly as the CDC wants us to do it. So that's incorporating, the wearing of PPE and other things. So we're being very careful with that, but with our level of carefulness in terms of who we are allowing on campus, it is impacting our staffing. We have always staffed high, particularly in the health center, and this is a measurable number. I've shared this information a few times in the last couple of weeks, but our payroll data goes right to the federal government, and right from our payroll provider, they're able to identify, how many registered nurse hours have we had, how many licensed practical nurse hours have we had, how many CNA hours have we had, and it actually culls that data every pay period, and then compares it to the national averages and the state averages for our, competitors, so to speak. And we then compare it to the New York State brand new safe staffing law that came into effect on the 1st of January. So we know that we always staff significantly higher than the national average, the state average, and the new mandate that went into effect. So because we always have so much cushion, that will help us weather this challenge. We are also incentivizing, per diem staff and others to pick up shifts. We're modifying some things where we have to. So, a great example would be the independent living dining room being closed. It's closed because we're concerned about, transmission, unmasked transmission, but it's helpful because we can staff fewer staff there. And then if we have excess, dining staff, we can float them to the health center and so forth. So team's doing a great job of keeping all of our services that we have going open right now. And right now, we do feel confident that we will be able to resume congregate activities, the dining room reopening and so forth, as soon as Wednesday, the 12th. So as of right now, that plan is still in effect. I just want to remind everyone, we have a lot of new residents. So I just want to remind everyone sort of how this decision-making process works. So anything that's in the community building, so basically from the library, down to the pool and past the pool, and the dining room, main dining room, all of that, all of the decisions of what happens in those areas is the decision of management. There is no state regulatory oversight. There is no federal regulatory oversight beyond just the typical health department. So they will not tell us you need to close your dining room or you need to close your pool. We need to make those decisions based on a comfort profile that our infection control team develops. So our infection control team is comprised of the leadership of many of our departments, and as well several registered nurses that are in our employment here on campus and specially trained in infection control. So we make those decisions for independent living and community building based on our comfort level on campus. The health center is a totally different story. So, and to even complicate matters further in the health center, not only is the health center distinct in that the New York State Department of Health and the federal government oversee and regulate all of the decisions that we make there, but assisted living and Garden View, which is our memory care unit, is separately licensed and regulated from the skilled nursing unit. So they have two totally separate sets of regulations, and they don't oftentimes jive. So Philip Mail, who's our director of long-term care, and my clinical nursing team and so forth, the support team in the health center, really are responsible for understanding and adjudicating the many regulations that impact the health center. So oftentimes, when you see a memo come out or a change in protocols or something that comes announced by me, most of that is promulgated by some kind of a regulation at the state level. So we have much less discretion in the health center, and oftentimes questions come up about that, but the state views appropriately that our health center residents are, typically more compromised health-wise than someone that might be in independent living. So it's not, I think, unexpected that you would have different regulations in those areas, but certainly that is the case. And just one more final confirmation, visitation on campus is completely acceptable right now. Visitors are allowed. We are screening all visitors, so no visitors should be coming in any side entrance. We must screen every resident, take their temperature, ask the appropriate exposure and symptom questions, and so forth. So if you do have visitors coming, even if you're in a cottage or if you have exterior access to your apartment directly from the outdoors, we really need those visitors to be coming in through the concierge or through reception so that we can record that they were on campus for contact tracing purposes and also for screening. So I just want to confirm that if you're having any visitors at all, they are welcome. And if they are unvaccinated, there's different, expectations of what they have to do versus vaccinated people, but visitors are welcome and they are welcome indoors. It's just, we must have them come through concierge and reception so that we can screen them in. In independent living, Sarah just asked me to remind everyone currently sort of where we're at in terms of expectations. So we currently have no group activities going on. We have the main dining room is closed. The pub is open, but for takeaway only. And we expect to resume group activity, reopen the main dining room, and allow seating in the pub for eating on the 12th, which is next Wednesday. And the reason that date was selected was because we looked at New Year's Eve and the New Year's holiday weekend as sort of, the next probably likelihood of folks gathering. And we wanted to give the 10-day incubation period after that. So that's why we're looking at next Wednesday. And we are really anxious to get, the main dining room back open, group activities going again, and so forth. So, but in the meantime, no one should be doing any kind of, unmasked group activity on campus. It's not safe right now. The numbers in Ulster County are through the roof. So if you're going to get together, that's okay, just as you can get together with your visitors, but we're going to ask you to stay masked the whole time. So if you're having a visitor, if you're having visits with each other, do it outside if you can. It's still nice. It's crisper, but it's beautiful. Do it outside if you can, but if you have to be inside, keep your masks on, both people or all the visitors, and try to keep more than 6 feet distance. You don't have to eat during a visit. You can eat before or after. Keeping that mask on is what's going to be critical in allowing the visits to be able to continue as they are without causing undue risk. So again, visits are fine. If you have any symptoms of illness at all, so right now, COVID is presenting as a headache, as nausea. We've had people with vomiting. We've had some that have fevers and some that have no fevers. We've got lots of congestion, shortness of breath, some sneezing, but not so much, more sore throat. So essentially at this point, unless your knee hurts or something like that, that you can rule out is not COVID, if you have any symptoms of illness at all, we really need you to be monitoring yourself. And you can report your symptoms to any nurse on campus. If you live in the health center, obviously we're monitoring you anyway, but if you feel something and it hasn't been discussed, call a nurse, call an aide and let them know how you're feeling. We want to track your symptoms. We want to keep an eye on you. We want to make sure that you're not having any kind of an escalation of symptoms. If you live in independent living, then, we actually now have wellness RN services around the clock, 7 days a week, not in the evening time. Daytime hours, 7 days a week. So Mary Jo Murray, who has been here for years, is here Monday through Friday, regular business hours, and Thursday, Friday, Saturday, and Sunday, Angel Murphy, our second wellness RN, is now back in independently living full time. So over the weekend, if you have any concerns or anything like that, you're going to call concierge, call Angel. She's going to come check on you, just as Mary Jo would during the week. That is really an awesome thing. So for the residents that have been here for a long time, there's always sort of been a question of when can we get, a nurse here on the weekends? Well, now we have a nurse here on the weekends, and just as much as MJ can come and help and answer questions about, a new diagnosis, a concern that you're having, an ache or a pain or whatever, Angel does all of that. She is doing friendly visiting programs. So, even for those folks that may not have an ache or a pain or a new concern, Angel does, talk to our team, our leadership team, and say, who haven't we checked on in a while, who might need a visit, who could benefit from me stopping in. So she's kind of filling in her time that way, similar to what Mary Jo does. And so the message, I think, most loudly that should resonate here is that unless one of them is on vacation, which they're allowed to do, we do have now wellness RN coverage in independent living 7 days a week. We had started getting to that point during the middle of 2021, and then Angel services were needed in the health center as an RN, but now they're sufficiently staffed there, which she's able to come back and be here in independent living. So we're really excited about that. And I hope that you all get to know her because she's a great resource, just as Mary Jo is during the week. Let's see. One more thing just before I go. If you are going out in the public, you should assume that you are being exposed to COVID basically at all times. It's just everywhere at this point. So this isn't to say that you shouldn't be going, because we do have to learn to live with this virus, to the extent that we have learned to live with common colds and the flu and strep throat and a myriad of other things. But you should be thinking about the fact that you're probably being exposed, and do those things that you would need to do to make sure that you're safe in that environment. So certainly masking and wearing a mask fully. So fully covering your nose and your mouth, okay, like this, a nice seal on both sides, okay, like this. You have to wear up pretty high on your nose. I know that causes issues with glasses and things like that, but you can actually buy a defogging solution for your glasses that can help. Different types of masks prevent fogging and so forth, but that transmission by nose and mouth is really going to be essential to try to protect yourself from. So you should be considering yourself as if you're exposed no matter where you are, because many people are carrying this right now and have absolutely no symptoms. So we are doing routine testing of staff for exposures and other things, completely asymptomatic, feeling great, no fever, no nothing, and they're coming back positive. We've been seeing this time and time again. We're seeing it being reported in the news. We're absolutely seeing it in Ulster County. It should just be the assumption sort of that everyone has that this is what's going on. So keep that in mind as you're going out and about in your day, and just make, those safe decisions. Use the hand sanitizer, wash your hands all the time, keep 6 feet distance, keep your mask on. Don't go into places if you don't need to, or if you do, avoid the crowded times. And that's going to be one of the ways that we can learn to live with this virus. The last thing I just want to mention was on my list earlier, and I failed to see it, is we are not going to be putting a sign-up sheet in for the fitness center because we're anticipating it reopening next Wednesday. There is most of the day, the fitness center is empty. I can say this because I walk by it and I take people on tours and they say, why doesn't anybody use the fitness center? There are a couple of times each day, and it seems to vary by which day of the week it is, that it is busier than others. So if you are concerned about whether or not someone is in the fitness center at that time, so you don't, have to make a trek and then find out that you have to sit and wait, then you can call up and find out if there's somebody in there. So, if you have a longer walk and you don't feel like walking down and seeing if there's someone in there, you can give a call and find out if there's somebody in there. Again, this is a very short period of time. Most of the day, the fitness center is open, so you may not go exactly at the time that you thought you were going to, but there are plenty of times that there's nobody in there at all, the lights are off. So just a little bit of flexibility on that would be great, as we continue to sort of move through with the anticipation of resuming all group activity next Wednesday, as I indicated. If you need anything or have any questions, I will be in the office all week. You know how to get me on email. You know how to get me at my desk, and I will see you soon. Thank you.